Snake bite poisoning. It is life-threatening condition. It basically affects farmers, hunters and rice pickers. Nearly 40% of bites by venomous snake do not produce signs of envenomation. Peak incidence is in monsoon. Most frequent sites of bites are lower limbs. Families of poisonous snake. Ellipidae contains of cobra, crate mammals, coral snakes. Hydrophidae consists of snakes of seas. Viripidae of viper and pit vipers. Composition of snake venoms. Snake venoms are complex mixtures of enzymes, polypeptides, glycoproteins, and metal ions. Hemorrhages causes vascular leakage and bleeding. Procoagulants, active clotting factors, and cause consumptive coagulopathy. Proteolytic enzymes causes local tissue necrosis and damage. Cardiotoxins causes myocarditis and reduced cardiac output. Neurotoxins causes peripheral neuromuscular junction and inhibits nerve impulses. Venomous. We will differentiate venomous and non-venomous poisonous snakes. So here are some of the following differences between venomous and non-venomous snakes. Please take a screenshot for detailed memory. Next we will move to clinical features of snake poisoning. So anxiety, fever, hyperventilation, syncope. Hyperventilation leads to paresthesia and carpopedal spasm. Some of the local manifestations: pain, tenderness, paresthesia and swelling of bitten limb, bullae formation, bleeding and ecchymotic patches. Next we will move to the another topic, that is limb pain, absence of arterial pulse and cold limb. Together we called it as it is nothing but compartment syndrome. This may lead to gangrene of limb. Neurotoxic effects of snake poisoning. Predominantly Ellipidae bites. Paralysis first appears as bilateral ptosis, which will further lead to bilateral ophthalmoplegia. And then it paralyzes the muscles of palate, jaw, tongue, larynx, neck, and muscles of deglutition, and finally respiratory failure. So the treatment is ASV and neostigmine. Hemostatic abnormalities. Due to hemorrhages and DIC, bleeding of wound site, gum bleed, nose bleed, venipuncture may occur. This will further lead to hematemesis, hematuria, intracranial hemorrhage, and this will further lead to hypotension and shock. So, as hypotension occurs, congestive cardiac failure, EMI, and sudden cardiac arrest happens. Infraction of anterior pituitary may occur, causing anterior pituitary adrenal insufficiency and panhypothyroidism. So, following are the investigations done when the snake poisoning case comes. So, here are some of the investigations done, such as dry swab of bite site, 20 minutes whole blood clotting test. If there is absence of coagulation, it indicates hemostatic defect, PT and APTT levels, full blood count, urea and creatinine levels, and, and hyperkalemia, troponin test for elevated MI. Urine examination shows RBCs, RBC casts. ECG shows arrhythmia and electrolyte imbalance. Please note down all. And next we will go for the treatment part. So when it comes to treatment part, This we will continue from the help of doctor in our next video, that is part 2. Until then, like our video, subscribe and follow for more interesting educational videos. Thank you.